Hi, thank you. It's great to be here. Have the opportunity to share what has been a great success for us in regards to this challenge. So the endoscopy challenge first started up in about 2022, and at that time obviously we're just coming out of the back of the pandemic, and this really was one of our burning platforms in the NHS. We'd struggled to get people in for scopes during the pandemic, and we ended up with a backlog of about 30,000 people waiting for scopes. Clearly that's not the quality of care that we want to be giving. And we were doing everything we could with the resources that we had, but we certainly had burnout in our staff, and we were cognizant that some of our patients were being delayed in their diagnosis and thus treatment. So this is something that we really, really did need to change, and we needed to change it quite urgently. Thankfully, we managed to work with the Challenge Fund, and we put together a scope of what this could look like. Now, this scope is really big, and it's gone from looking at training, technology, AI, workflow, decontamination. It's a big network really across endoscopy. In retrospect, maybe we should have toned this down and been a bit more specific, but this is where it started. Now, ordinarily, if we were doing something like this, we would go through procurement and we would put a prior information notice out, but we did it differently for this, and that's been fundamental for the success of the programme. We put together a project board which was key to its success because it had the right people involved right from the beginning. So we had clinical experts, we had operational experts, which is hard to get hold of because they're the ones constantly firefighting, so it's hard to get 5 minutes of their time or buy-in. Innovation team was myself, and as has come up so many times, procurement was involved right from the outset. CCR Challenge team was fundamental to giving us support and guidance right the way through the process as well. The flexibility of the approach allowed us to bring in experts as we needed them. So as the research moved and changed, we brought in sustainability experts and decontamination, and it was great because we managed to have constant support from the people who knew best. The money that came with the challenge, about £750,000, was obviously key in a very skin NHS. We can't do this without that sort of support, and it allowed us to work with Simply Do, who are fundamental in getting the right people to apply for the challenge. We could have put a pin out and it could have reached so many people, but Simply Do actually went out and funneled those people in. So we got some really strong applications, and you can see the numbers there. The final two companies that were successful was CanSense and IQ Endoscopes. So in terms of the innovation procurement process, this is something we hadn't done in Cardiff and Vale previously. I'm not a procurement expert, I'm a nurse background, so it was a steep learning curve for me, but it really worked. It was very flexible, and the whole challenge from a Cardiff and Vale perspective was held by procurement. So they were in it from day one. They built those relationships, they understood the programme, and they saw the iterations of the development of the technology and where it could fit and support our patients and our service users. Yeah, I won't go into the problems we have with procurement because I think it's been covered really, but I definitely increased our opportunity to adopt the technology at the end of this. We ran it as a 3-phase programme with the two companies going through the first 2 phases. Fairly loosely it was concept development and product development, but we would meet at the beginning, we would set a scope for that phase, and then we would allocate the money according to the scope that was set. So it wasn't a set, we have £50,000 to spend for you here. We really worked flexibly to make sure that we were funding what was needed to develop the project. We're now at phase 3, and we've gone down to just supporting IQ endoscopes. That reason being, CanSense are doing amazing things as well, but they're heading towards research. The next part of their programme was research, and that wasn't in our scope. So then we were able to focus solely on IQ, and we're actually at a point of adoption, which is just incredible, really. We didn't think we'd get there. We thought it was going to be a 2-year programme. We did extend to 3 because we were learning so much, and actually it was fun. And I say that lightly, but at the moment it's really quite hard to find fun in the NHS, and the relationships we've had and the communication and being able to see the positives of this. And that's really important, to give people that lift. I'll run through because I know Tom's coming up. The benefits have been huge. We've been able to find the right technology to meet our demand. Quite often technology will come in and we're retrofitting it. We're trying to make it adapt, or we're trying to adapt services. That's time consuming, it's exhausting. This has been just fundamentally different, excuse me, because we've been able to build the technology to meet the demand of our patient population. And so everybody buys in then, because you're part of that process. And it works, and the relationships we've had have grown, and we've now, we've won awards, and we've written papers, and we've done posters, and all of that builds that morale. Essential to success is the right stakeholders right from the beginning, having procurement, having the funding to buy people's time. So having, we paid for a project manager, paid for my time, procurement time. For the third phase, we've paid for 3 sessions of a clinical fellow. So NHS doesn't do this very well. We don't have time. We're always firefighting. We're seeing patients. Any innovation and projects like this are done on top of that. And honestly, it tends to be people doing it in their own time. So by having that funding from the Challenge Fund to support those roles has made it happen. I don't think it would happen without that. Running through, definitely we'll continue the collaboration with IQ. We're at a point of procurement and adoption, which is fantastic. And Owen, yes, we would like to talk to you because we really recognise the importance of identifying a problem and then coming together with our wider stakeholders to make sure that we make the right choices and create the right solutions. And on that note, I'll hand over to Tom.
Okay, thanks everyone. Thanks, Zoe. Great introduction, and a lot of what I'll say is sort of supporting what Zoe just said, so excuse that. I'm Tom. I'm one of the directors at IQ Endoscopes. We're a company based in South Wales, a team of about 30 people there. We're a medical device company, and our aim is to bring GI endoscopy to transform the endoscopy market and aim to address some of the challenges that Zoe's just introduced there and support the NHS. So just taking a step back, the wider picture, Zoe mentioned 30,000 people waiting in Cardiff. It's a huge problem. It's not just Cardiff, it's UK-wide, it's worldwide. And you can see some pretty stark facts there. One sobering fact that always runs a chord with me is 1 in 2 of us will likely get cancer at one point in our lives. Just let that settle in, and you're bound to know someone who has. The key prevention is early diagnosis. If you diagnose quickly, early, you can prevent a lot of the deaths and a lot of the complications. A lot of this is in GI cancers where we specialise. So the technology that we can bring can really help this. At some point to diagnose, you're going to need to look inside the body. We are looking either in your throat or up your back passage, but it's something you've got to look inside to be able to sort of see. So moving on, how do we, what's our vision, our mission? I'm talking about missions all day today. Our mission is to drive rapid early diagnosis. This is what we're about, diagnose now to solve this problem. So we have a sterile, single-use endoscope. It's designed and built in the UK by clinicians, for clinicians, so they know what they want. And designed to help more patients around the world and in a more sustainable way. Again, we've talked a lot about sustainability today, and there's a lot of reservations if you start saying single-use endoscopes. What does that do for the environment? I'll come back and touch on that because it's important, and it's important to our mission. So some of the key things that we want to introduce in our technology, it's got to be affordable. If you heard about challenges in the NHS, plug and play is really important. Clinicians don't want new technology they're not used to. It's harder to adopt. So it's been built by clinicians to look and feel like the current technology, aim to increase that capacity, and to be more sustainable. So this is what our scope is being designed with all the features to enable us to use rapid access diagnosis. And what does that mean? It's fully portable, so you can move it around the hospital. The current sort of solution is a reusable scope. They're £60,000, mainly in, and they're stuck in one endoscopy suite. If they're used on you, use on me next, they've got to be washed and cleaned in between. So they're more like a fixed capacity. Of course, they're expensive, and it's hard to scale. You've seen the increasing numbers coming through. How does the NHS scale that problem? And we believe we've got a solution then that, one, it's got the optical performance that is ideal for diagnostics, and it allows that amazing reusable technology then to be prioritised and used for the most sort of complex cases, cancer patients, high-risk patients. And we're aiming to support the net zero requirements for the NHS. So, going back to this, it's all well and good making those statements, but we never put it into practice in reality. And the point that I think Ravi made earlier is how do you sort of, I guess, sell the story with proof as well? And this is, where the Cardiff CCR Challenge Fund has come in, and real brilliant opportunity for us to sort of prove that and to work with NHS to sort of embed a technology as a whole. So just a reminder what that Challenge Fund aim was. It was, how can innovation accelerate the delivery of endoscopy procedures in Wales, improving access and reducing waiting times. We said about 3 different phases, which is really important. Over those phases, the product iterated. Phase 1 was about establishing a baseline of our carbon footprint. Phase 2 was trying to understand if you're introducing single-use technology into the trust, what effect does that have within the clinical settings? So there's a lot of data there that have been pulled out with CEDA and the health economists there to sort of really understand that. And then phase 3, which is what we're currently progressing through, be finished in July, is to put that into practice. For clinicians to use our technology and to really understand the healthcare cost impact and the sustainable impact of introducing that technology into the NHS. So this is an equation which we hold true to the heart at IQ Endoscopes, and I'm sure probably part of the procurement team in the NHS, whether they look at this, but they'll be looking at, for example, in assessing new technology that's being introduced. So sustainable value is all about outcomes over costs, and if your outcomes are greater than your costs, then you're onto a winner. If, for example, though, we can show that the environmental impact of introducing new technology and the healthcare impact and the financial impact is all win-win, then the patient wins, the provider wins, and the planet wins. So this is really sort of key to trying to understand this. And we're still working through some of these numbers. I don't know if you can see them. And I was very nervous about showing one of these numbers here. So part of the phase 3 project was to understand the carbon footprint of our product. So looking at all the materials are sourced, how it's been sort of put together, the materials in the product. And we've come up with a carbon footprint of our product on our first sort of design of 16 kilograms of CO2. What does that mean? It's roughly the equivalent of 1 car journey to an appointment on an average person, just to put it into some context. But we're not looking at it from just a device versus a reusable device, and there's a lot of literature out there. For example, a reusable could be 4 kilograms, but it could be 60. So it depends how you sort of look at it with all the sort of processes. What we're trying to look at is, if you're introducing our single-use technology into the hospital, what benefit does it have in the clinical settings? If it's making things more efficient, people are waiting less time in beds, less appointments, you're delivering faster diagnosis. What is the sustainable impact of that new technology? So you've got to look at it in a holistic approach for it. We're still looking at the financial impact, that's to come, but hopefully it will be in a similar sort of upside from the environmental impact. And just to note, one initial thing is actually showing introducing single-use technology could have a 40% saving in CO2 within that whole process. So, and I think this is the big enlightenment really of the project. A lot of reservation to start with, going, nah, we don't want single-use. But actually when you're looking at it from the whole process, it really has the benefits that flow through the project. And the funding has been key to establishing that data and bringing people on board with that. But one of the key things, and ultimately, it's about the waiting lists and getting people diagnosed faster. What we've been able to demonstrate as part of the project is that it allows increased capacity and it allows for rapid access diagnosis in different clinical settings. So as I said earlier, the current technology is fixed in one endoscopy suite. If we take our technology, say, to the operating room, inpatient, potentially into communities, you're using it in different areas, which relieves the pressure on the endoscopy suites. So you're basically expanding that hopper with new technology so more people can ultimately be seen and we reduce the waiting list. I've been told to hurry up here. So working with Cardiff, what's under veil, it's been, I think it's, in summarise, I think it's been a brilliant process and, adding value across sectors, public sector, private sector, the exposure we've had to independent experts, procurement teams has been sort of fundamental for us all to understand this. And that collaboration and, as we mentioned, fun, I think has been really brilliant process. We've had access to clinicians to support our progress. And I think it's enabled all teams to learn. So, for example, we've learned about the challenges in the NHS and how to affect, rather than just directly selling into it, how do you understand their problem to help work with them? So it's been a huge collaborative approach. And ultimately, I think we've developed a solution that meets the challenge that helps the wider society. So opportunities for the future. Where does it go next? We finished the project, and we've already secured a sales order for 200 scopes to prioritise rectal bleed patients in a out of clinic sort of area. So this is a project that's gone from here's an idea, or there's a problem, solution. We've got an idea, we've innovated, and we're actually coming to it's changed into a real life problem with actual scopes and changes in the system. So it's been hugely advantageous. Going forward, all the data and the value that we've uncovered there, this could potentially help 3,000 people in Cardiff, taking that data and be able to sort of shape your sort of value proposition so we can expand then into the rest of Wales, into the UK, and globally as well. We've seen the sort of global stats. That's our sort of aim. So yeah, in conclusion, been a hugely beneficial programme, and I think this should act as a catalyst for future growth and future benefit to society. So really, really thankful. And yeah. Yeah.
Thank you very much, Tom, and yourself, Zoe, for that. Good news. We've got the opportunity for around 5 minutes for some questions.
Thanks. Really enjoyable to hear about such a successful outcome from the project. I want to ask Zoe something about whether you can point to, or you think there's the opportunity for at least parts of the NHS. You mentioned the organisation itself is not, as universities we would recognise this, not necessarily set up to do this sort of thing. So along with the specifics of a successful project, have there been things you've learned and the organisation can learn about how you currently do things or how you might do things differently that you're optimistic can see something of an internal organisational change that makes this type of activity more likely in the future?
Yeah, I think it's very Rick. It's topical. So I think I like to talk to people. And so I've really tried to spread the word about this, and the film that CCR have helped us, or the Challenge Fund have helped us put together, is going to be really key to that as well. We talk about partnership working all the time and collaboration. And I think it's been words on strategies for a long time within the NHS, but nobody's really picked up and run with it. And I think in the last couple of years that's changed. We've had the Innovation Strategy for Wales published, and there's a drive behind that of how that gets implemented in the Health Board. In Cardiff and Vale currently we're just setting up the Joint Academic Health Science Partnership, which is a partnership between Cardiff and Vale, Cardiff Uni and Velindre. And that is very much about creating these relationships, creating these processes within those three organisations certainly, and hopefully that will deepen and grow. And I think this challenge has been a keystone for that. I think it's changed the way procurement look at things. And it takes dedication and it takes commitment and it takes those willing individuals in procurement because it takes more time. Building relationships and maintaining those relationships takes time. It's not just a transaction, which procurement so often is. But then the pleasure that we've had out of that is being part of something that's very important. So I think it's changing. If I have anything to do with it, it will change. But yeah, does that answer your question?
Yeah, thank you, Rick.
Thank you. Abbas from Cardiff City of Century. I am wondering about the waiting list. When we heard about the waiting list, is there any plan in the future to make cooperation between NHS and the private sector to solve this problem? Thank you.
Well, within this challenge, we're working with IQ to look at what it might cost for IQ to set up a service rather than it being set up. So it would be, they would fund a service rather than NHS setting it up because we don't have any money. You know, we're not allowed to go on training at the moment. We're not allowed to, barely allowed to be here. So we are looking at that, and we're looking at the cost of different ways of working. There's a national endoscopy programme as well, which is also looking at that. So it wouldn't necessarily fit under my remit, but it's something that I don't know if you want to come in on.
I think it's a challenge, isn't it? You know, I guess as a private company, we've got, I guess, different stakeholders and different sort of requirements as well from the public sector, and it's trying to sort of find that middle ground between the two. And you know, ultimately, as a company, we've got people there we need to pay, and we need to fund profits to enable that to happen. At this stage, you know, we're a company that's going through significant investment. We've raised sort of 15 million to date, and you know, part of this program has helped us leverage more investment into the program because we've achieved milestones along the way that's really supported that. But certainly, in early stage of, I guess, product development. And trying to put that into the NHS, it's difficult. And I think, yeah, companies have to invest to enable that to happen as well. So is there a short-term sort of, you know, sharing of those costs that will enable that change? And when change can be proven, I think the NHS then will invest, you know, normally within those services. But it's got to allow change to happen first and get them over those sort of challenges.
Tom, I'm sorry to ask another question, folks, but I couldn't resist. When you say about selling into the NHS,
yeah.
now this is proved to be an enormous challenge from our point of view. It's not just selling, presumably, once into NHS Wales, as if NHS Wales is a single body. The NHS is famously balkanised, isn't it? Each health trust is a silo. Have you had a challenge doing that, getting, you know, one entry point, as it were, to access the whole of the NHS to sell this product, or do you have to go? How do you do it?
Yeah, great question, and I think I had a similar question from Olivia sitting next to me earlier, and you know, I think partly this challenge has enabled that sort of, you know, catalyst for that to happen. You know, generating the value and the data from this will allow us to sell into, you know, have that information there to go and sell into other trusts and hospitals. But I think some of the approach, and one of the colorectal surgeons there in Cardiff said, it's so refreshing to have a company that comes without just trying to sell you something, but actually work with you to understand that problem. So taking that mindset into other trusts and hospitals is certainly something we'll be looking to adopt. But yeah, you're right, you know, selling across just Cardiff is one entry point, but what about the other Welsh hospitals? And you know, I believe there's a Welsh programme where one in procurement that's shared across Wales. But then how do you know, a company's not going to be supported, I think, just by the sales in Wales. We have to sort of expand and then sort of move into, you know, the rest of the UK. I think there are similar challenges in Northern Ireland as well. And then ultimately sort of, you know, into Europe, possibly the States, who knows what we talked about earlier. But yes, it's learning as we go, and I think there's no one way of doing it, and there's lots of people to influence on the way with it. Clinicians, the procurement teams, CFOs of the trusts and the CEOs of the trusts, and cash is tight, and you've got to sort of, and time is tight as well. So you've got to find any entry point you can find, really. If that answers your question.
Fantastic. Huge round of applause for Tom and Zoe, please.
Thank you. Yeah.